inflammatory condition of the pulp, symptomatic or asymptomatic in nature, with the pulp becoming incapable of healing. When we see the persistent inflammatory condition in which पल्प सिम्टोमेटिक हो सकता है, एसिम्टोमेटिक भी हो सकता है उसके नेचर में, बट पल्प जो होता है वो कैपेबल नहीं होता है हीलिंग के लिए, सो हम उसको बोलते हैं इरिवर्सिबल पल्पाइटिस. So we are going to see the types of the irreversible pulpitis. The types are asymptomatic irreversible pulpitis, symptomatic irreversible pulpitis, chronic hyperplastic pulpitis, and internal resorption. In asymptomatic irreversible pulpitis, we are seeing no symptoms of pain. In symptomatic irreversible pulpitis, the patient complains of pain and other symptoms are seen. When in chronic hyperplastic pulpitis, it's also called a pulp polyp and internal resorption. So, what are the clinical features? Clinical features are pain. Pain is the lingering pain referred to the, and pain also referred to the adjacent teeth to the temple, sinus, upper posterior teeth, and the ear to the lower posterior tooth is affected. Mobility is not present, percussion is not present, and palpation also is not present. So we are seeing the cause on bacterial involvement of the pulp is most common to carry or any other fact. Now we are going to see the symptomatic irreversible pulpitis of the pulp symptoms, because asymptomatic irreversible pulpitis has no symptoms. So so we are seeing symptoms of symptomatic irreversible pulpitis. Pain is usually caused by a hot or cold stimulus when persists for several minutes to hours. Pain may be sharp, piercing, or shooting. Pain may be intermittent or continuous. Patient may complain of postural pain. So, what is the postural pain? When patient change the position, lying, sleeping, the intrapulpal pressure of the tooth is increased. So, pain is severe when patient is sleeping or lying. It's called the postural pain. In later stages, the pain is more severe and it's described as burning, gnawing, or throbbing pain. Throbbing pain is like under constant pressure, pain is felt. So we are going to see the histopathology. In histopathology, inflammatory changes in is severe to as the decay approaches the pulp. Inflammatory changes carry a long-term nervous stimuli, giving the denting penetration, and severity increases, the decay is approaches. Post-capillary venules, these are the post-capillary venules. Post-capillary venules become congested, and when the post-capillary venules congested, it affects the circulation of the pulp. Pulp become necrosed. When pulp necrosed, the chemotoxis reaction is occurred, and the chemotoxis attract the polymorph nuclear cells. The polymorph nuclear cells are giving the inflammatory reaction and produce the microabscess. The inflammatory reaction occur, the inflammatory reaction to the phagocytosis, and then microabscesses are occur. Further, we see the area of necrotic tissues seen, zone of infiltration by polymorph nuclear leukocytes are seen, zone of proliferating fibroblasts are formed the wall of the lesion, because the pulp is self-protecting reaction done to the pulp protection by itself. It's called a self-protection of the pulp. So, what is the treatment? Complete removal of the pulp, also called pulpectomy, and extraction should be considered if the tooth is not restored. Then it is emergency situation, the pulpotomy, or extraction should be performed. But if patient have no time or sufficient time, pulpotomy, yeah, coronal pulp is performed. Prognosis is favorable if endodontic treatment is given. In endodontic treatment, the removal of the pulp and restoration of the pulp is done. Now we are seeing chronic hyperplastic pulpitis. It's also called pulp polyp or pulp hyperplasia. In the teeth, we can see the polyp-like creation where pulp is come outside of the tooth. Chronic hyperplastic pulpitis. It is a productive pulpal inflammation due to an extensive caries exposure of a young pulp. The differential diagnosis is when the or the proliferative gingival growth. The probe is taken and the polyp is raised and the end of the polyp is traced. If attached to the gingiva, it's called gingival polyp. So, what are the causes of chronic hyperplastic pulpitis? When the slow progressive carious exposure of the pulp is happens, it causes the chronic hyperplastic pulpitis. When the large open cavities are present, a young resistant pulp is developed, and a chronic low-grade stimulus is required for the chronic hyperplastic pulpitis. The symptoms of the chronic hyperplastic pulpitis. It may be asymptomatic or pain may be fade during mastigation because when mastigation or chewing occurs, the pressure of pressure in the apical end of the pulp is created, so the pain is felt. It's asymptomatic because of bacterial infection is present. The histopathology of the chronic hyperplastic pulpitis. Surface of the pulp polyp is covered by stratified squamous epithelium. The pulp tissue is chronically inflamed, and the presence of the granulation tissue in pulp chamber is present because the polymorph nucleosides, the lymph and plasma also present. So the granulation of tissue is happen. So what are the treatments of the chronic hyperplastic pulp polyp? The treatment is removal of the pulp or pulp extirpation. So when the pulp polyp is cut, there is no pain, but when the pressure is given on the pulp polyp, the pain is occurring. When the removal of the pulp by the removal of the pulp, the bleeding can be controlled by pressure. Pulp chamber is removed by the scoop excavator. Temporary dressing and calcium hydroxide is sealed with contact of the radicular pulp tissue. Radicular pulp removed at the later visit and it is restored. Next is pulp extirpation. The pulp extirpation is when the elimination of the polypoid tissue is removed by H file. It's called pulp extirpation. So here we can see the structure of the pulp polyp, the granulation of the tissues, and its covered epithelium present, is covered with the epithelium. Low grade irritation is given, and the long standing low grade irritation is caused the pulp polyp. Prognosis favorable after the endodontic treatment and restoration is done. Now we are seeing the internal absorption. So what is the internal absorption? It's also called the pink food. Internal absorption when the pathologic, slow or fast progressive resorptive process occurring in the dentine of the pulp chamber or in the root canals of the teeth. It is called internal resorption. So what are the causes? Causes are now not unknown causes, not known, and most of the patients have the history of the trauma. When the resorptive process occurs, the physiologic or pathologic loss of dentine, cementum or bone is done, it is called the internal resorption. What are the symptoms of the internal resorption? It's mainly asymptomatic root reddish area called pink spots in the ground. When the radiographs are taken, we can see the pink spot, and by externally we can see the pink colored in the section of the crown. Now we can see the histological feature, histopathological features of the internal absorption. It is characterized by the lacunae, presence of the granulation of the tissues, multinucleated giant cells or the dentinoclasts are present, and pulp is chronically inflamed. So, what are the treatments of internal absorption? Treatments are extirpation of the pulp, stops the internal absorption process, extirpation by the H files or files done. Obturation. Obturation is the process of filling the canals. Obturation of the defect, preferably with a plasticized Gutta-Parcha method. In case of the root perforation, MTA is used to repair the defect. MTA is a mineral trioxide aggregate. So, what are the prognosis? Prognosis is favorable before perforation and poor prognosis after the perforation. So, here we are ending the disease of the pulp chapter.